Bismillahirrahmanirrahim. Good morning. I am Professor Dr. Syed Amir Gilani, and today we are going to talk about Doppler studies of uterine vessels. The uterine vessels are very important to be assessed, which are usually ignored by most of the ultrasonologists. We need to know there are main vessels. We have got two uterine arteries on both sides, and the main branch of the uterine artery is arcuate artery. So we have on both sides we have uterine arteries with their branches which are called the radial arteries. Then we get the spiral arteries which are entering into the endometrium of the uterus. So this is the Doppler study on ultrasound where we can see the arcuate arteries, and it is forming an appearance of necklace. Here is another study of the uterine artery where we can see the reproductive age in which we will have this type of flow, and this is the vessel, the uterine artery here, and this type of biphasic flow we get. We can see the resistive index is 0.766, which is indicative of the normal reproductive age. In proliferative phase, we will get this type of appearance. More resistance is there, 0.91 resistive index. Then is the excretory phase. In excretory phase, you can see the resistance is a bit changed. It is 0.81 as compared to the 0.91 which was in the proliferative phase. It is biphasic, but its spectral appearance is changed. We have got the forward systolic and diastolic flow. The systolic flow has decreased as compared to the systolic flow of the uterine artery in the proliferative phase. So we will have to assess the spiral artery blood flow, then is the endometrial profusion, then comes the uterine receptivity and implantation rate. We will discuss these things. First is the spiral artery blood flow. The spiral artery blood flow appears like this on power Doppler, and you can see the flow pattern of the vessels. The vessel is entering into the endometrium. Whole of this is endometrium. This is the endometrial canal. So this was something introductory about the uterine arteries and how they appearance. Thank you very much.